Welcome back once again to the Parkinson's Disease Education Podcast. In this episode, we're going to be answering the question, how is Parkinson's disease diagnosed? This is a question many persons with Parkinson's have maybe struggled with in their journey with diagnosis. Some folks have been through the tests we're going to discuss today. Some folks may have not have had any of them. Regardless of that, we're going to be discussing various ways that Parkinson's disease can be diagnosed and how the condition of Parkinson's can be ruled in at least a little bit more specifically than, let's say, other conditions that we've talked about. Recently, we talked about atypical Parkinsonism compared to Parkinson's disease. Some of the tests we're going to discuss today help to compare and contrast Parkinson's compared to some of these other conditions and help to rule out some of those other possible forms of Parkinsonism that can look like Parkinson's but really don't behave the same way. I do hope you'll stick around until the end of the episode to find out more details. And without further ado, I'm going to have you join me on the other side of the intro. Welcome to the Parkinson's Disease Education Show, where we demystify the disease and empower you as the person with Parkinson's disease to reach your true potential. The content contained on this show is for informational purposes only and is not meant to be a replacement for information or advice that you receive from your in-person medical or therapy professionals. If you haven't already, I hope you'll consider subscribing, and for an even more personalized experience, please ask us about our memberships. Now, without further ado, let's start the show. Now, diving right into the topic of diagnosis of Parkinson's disease, it should be noted that up until very recent history, Parkinson's was almost completely diagnosed just by clinical evaluation or clinical observation, meaning that a neurologist sat down with the patient, looked at medical history, and then also looked at different aspects of the patient's movement. So it could be looking for slowness of movement, rigidity, stiffness, balance problems, looking at walking patterns, maybe looking at coordination tests such as turning the hands over and so forth. That paired with response to levodopa essentially gave doctors the green light to say, yep, this is a Parkinson's diagnosis. Now, there is a true scale that physicians tend to use across the world to diagnose Parkinson's and to also grade the severity of the case of Parkinson's. That's called the Modified Universal Parkinson's Disease Rating Scale, or the UPDRS. The UPDRS mainly contains 4 parts, and that assesses different aspects of the persons with Parkinson's. So, for example, Part 1 contains cognition, behavior, and mood. Part 2 is activities of daily living. Part 3 is a motor examination. And Part 4 is complications of motor function, or I guess how that's responding to current therapy. Now, put together, that score will come up with the Hoehn-Yahr scale of Parkinson's from 0 to 5, 0 being minimal to 5 being severe. Now, as I've mentioned in previous videos, I'm going to link one up here, the stages of Parkinson's disease are relatively arbitrary and tend to really be used as primarily a research tool to see how people are responding to medications and so forth. But don't think of the stages of Parkinson's disease as something that is static or can't change, because you may be a stage 4, but after intense therapy may move down to a stage 1 or a 2, or even lower potentially. Progression of Parkinson's disease also varies wildly between individuals. So somebody that has Parkinson's 20 years may not get to what's considered a stage 4 or 5 until way down the road, whereas somebody who was diagnosed 5 years ago might be at a stage 4 or 5 in a very short period of time. Each of those people might be greatly benefited by certain interventions like intense therapy programs, LSVT big, and so forth, plus medications and lifestyle changes. All that to say that the UPDRS is a great tool, but it really isn't great at ruling in Parkinson's specifically. As I mentioned at the intro, we've discussed in a very recent episode the differences between Parkinson's and similarities between Parkinson's and atypical Parkinsonisms, which can mimic Parkinson's and may be treated as Parkinson's when they really aren't going to respond the same to the treatments that would typically be prescribed to a person with Parkinson's disease. That's the reason why other tests have been developed that have helped to rule Parkinson's disease in or out a little bit more objectively. And that's what we're going to be talking about next. Now, that's why there are tests like the DaTscan that can help to show imagery of the brain that would help detect whether Parkinson's may or may not be present or not. The DaTscan stands for dopamine transporter molecule scan. They inject a radioactive dye, and it's essentially an MRI scan that looks at how dopamine is being absorbed in the brain. When the dopamine transporter molecule is present and active, showing that proper dopamine absorption in the brain, the scan will look very bright, and you'll see a nice contrast area where the dopamine transporter molecule is active. However, in such a case where there's Parkinson's disease or a similar condition, a much lighter, thinner area of dopamine transporter molecule visible, or a very minimal amount, and therefore it can be said with some certainty that Parkinson's disease is likely present. The kicker is that DaTscan doesn't really help to narrow down Parkinson's disease versus other Parkinsonisms, and that's where the other couple of tests we're going to mention now are really important. Biomarker tests have been a game changer in the Parkinson's diagnosis realm. The most recent developments in that area are helping to detect alpha-synuclein protein. And as you remember from prior episodes, hopefully, if not, I'll link it here. Alpha-synuclein is a misfolded protein that's found in aggregates or in large clumps in the cells of the substantia nigra in the brain, as well as in other nerve tissues throughout the body in persons with Parkinson's disease. There are other cyclonopathies besides Parkinson's disease. Parkinson's disease most definitely is marked by alpha-synuclein as a hallmark biomarker. It should be noted that Lewy body dementia is also a synucleinopathy and multiple system atrophy as well. So those tests may or may not 100% rule in Parkinson's, but it really brings that list down much narrower. So there's two tests that test for alpha-synuclein. The first one that was developed several years ago and is still relatively new is called the SYN1 test. Now the SYN1 test uses a series of skin biopsies that look at the nerve tissues just under the skin. The presence of alpha-synuclein in those nerve fibers, especially a ratio between the three areas measured. I believe the three areas the biopsies are taken are from the neck, the thigh, and the side of the ankle. Either that or the neck and the arm and the side of the ankle, but I believe it's the thigh. The ratio between those three, especially the higher the ratio between those three areas, the higher the likelihood is that it's Parkinson's or a very similar disorder to Parkinson's. In addition to the SYN1 test, there's a relatively even newer test that is found through lumbar puncture. So they're looking at the cerebrospinal fluid and the presence of alpha-synuclein in that fluid that circulates in the brain and throughout the spinal cord. That's probably within the last 2 years that's become a test that's available. Something that's important to remember is that even with some of these tests helping to rule Parkinson's in or helping to make it a much more narrower possibility, is that it still is a combination between these tests and the clinical examination and UPDRS scale rating that we talked about before. It's kind of a multifaceted approach to diagnosis. Unfortunately, there's no one-size-fits-all test that will absolutely rule a Parkinson's in or out, although it's arguable because the skin biopsy test, the SYN1 test, now granted these are internal studies, but the sensitivity and specificity of that test are remarkably accurate. Now, again, that's coming from the company that developed SYN1, so obviously internal studies are going to be a little more biased. I will quote them just for interest. It's 99% specificity, and I believe it's 96% sensitivity. So what that means in English is that if it's positive, it's 99% accurate at ruling in Parkinson's disease, or at least the possibility of having Parkinson's. Sensitivity, and I believe I misquoted, I think it was 97%. It was still very high. Sensitivity would indicate that if it's negative, it's 97 or 96, whatever percent it was. It's 97 or 96% chance that it's not Parkinson's. I hope that makes sense, but in any case, that's an internal study, and I don't want to quote that as gospel because I would want that to be validated by third parties. A final note is that a more recent development is that there's a possible blood test that may become available to rule Parkinson's in, even before symptoms really start to show up. One final note, and something that's kind of exciting to hear about, is I came across an article in the Times from the UK talking about a potential blood test for Parkinson's disease. This article is pretty recent. It was from June of 2024. And in this article, they talk about this blood test that could look at 8 proteins, I guess essentially that would be biomarkers of Parkinson's, that could then result in preemptive treatment for Parkinson's with drugs that help protect the neurons in the substantia nigra and theoretically prevent them from dying. This blood test supposedly would predict Parkinson's before symptoms could even show up. This is coming from the National Health Service in the UK, so hopefully that would be something that could be developed. I think that's pretty exciting to hear about. A blood test is really simple, and it sure is a heck of a lot simpler than getting a spinal tap or 3 skin punch biopsies. We're probably not there yet, but at least you know that's probably coming down the road at some point, hopefully. That about wraps it up for this episode of the Parkinson's Disease Education Podcast. I hope you enjoyed this. I hope you learned something today. Let me know in the comments if you've had the experience of being misdiagnosed, and if a test like this helped to rule Parkinson's in, or at least helped to steer your treatment in the right direction. One final note, we have several companies that are really gracious and have provided links to use to get their products that help support the channel. Please do consider using their services. I particularly recommend Kizik Shoes and Comfort Linen. Comfort Linen offers 15% off your purchase just by using the link below, and there's no extra cost to you. Thanks as always for being here and for your time. Look forward to seeing you in the next episode. Be empowered.